Well, let me jump to another question. And this question would be about your clinic. Dr. Jeremy, your clinic, Dr. Keeper's Dental Wellness, emphasizes a non-invasive, preventive approach to oral health. Can you please explain how this differs from traditional dental care?
Yeah, thank you, Leah. It's I want to stay positive here. Uh, how we approach things is that we say, you know what, we don't need a drill. We don't need to remove part of your body to stop the most common disease in humans. So cavities, dental caries, it's the number one most common disease in humans. It causes the most sort of suffering over a lifetime across the whole world. And gum disease is the fifth most common, even if you include the flu and everything like that in terms of hours of suffering across your lifetime. So it just doesn't seem right that with modern medicine, with what we've known, what we've learned, what we've forgotten from tradition, that we would have to do surgery to take care of this chronic disease that's caused by sugar. And then the bacteria go wrong, and more sugar makes them make plaque, and more sugar makes them make acid that's held against the tooth, and that acid dissolves the tooth. Where in there is a drill going to help? It doesn't change the bacteria. So we have medicines now that our practice is focused on that are in the essential list of essential medicines from the World Health Organization and are recommended in the American Dental Association guidelines. We have medicines that will make the cavity hard again. Teeth should be hard. Makes the cavity hard again. Stops the cavity. If it's a really bad cavity, maybe we need to put it on 2 or 3 times. If it's, a whole person, all their teeth are cavities, sure, maybe 5 times. But we literally take a little brush and just brush this on. It soaks into the teeth. It kills the bacteria and the weakened soft part of the teeth. It remineralizes and reinforces with silver and fluoride. And we have peptides that can rebuild the lost hydroxyapatite. We have a smorgasbord. We have a whole set of different materials now that actually help. And some are, the classic one is ionic silver. The newest one is nano silver. So it doesn't turn color. The old one turned color. But we have a set of materials that are approved and verified and recommended at the highest levels to treat the vast majority of problems in the mouth. So if that's the case, then why would you go somewhere where the first thing they say in this little tiny thing that you didn't know you had is to have surgery, a minor little surgery, but so that's what we're focusing on. Is we're focusing on bringing these solutions to everyone.
That's very interesting. Thank you so much. So, how do your brush-on therapy works? How, so far, how patients responded to this?
Yeah. So where we're at is I was practicing pediatric dentistry for the last 11 years. And some of that was doing research, some of that was doing policy work and in companies. Um, but in about 2014, I really started offering this type of care robustly to my patients because kids don't want needles, kids don't want drills. And the way that people do get the kids to get through needles and drills when they aren't ready for it is they sedate them. They put them through general anesthesia. Putting the kids to sleep in the operating room to treat this disease. A lot of parents were looking for another option, and some of them really wealthy, some of them not. And so this became very popular. People started traveling all over from 2 miles away, 200 miles away, 2,000 miles away, you name it, to
Mm-hmm.
come get this type of care. And the other people who were doing this around the country, a woman in Phoenix, a guy in Oregon, a few guys in Oregon, and somebody, peppered around the country, we all started experiencing this. And the funny thing that kept happening to all of us pediatric dentists was the parent would look over your shoulder and say, "Hey, where can I get this kind of care?" You know, I, and at that time, Leah, at that time, the main medicine that was making such a difference was turning the cavities black. That was part of the function of how it worked. We were mainly doing it on back teeth, and if we did it on front teeth, we would turn it black, and then after that, we would use a white filling material to cover it. But we were turning people's cavities black, and the parents or the grandparents were saying, "I want that too." And so that's why we started moving toward. Now, how does this actually work? So we have medicines. How does a medicine work? You swallow it or you get it in the area of the problem, where the issue is, what we call a lesion.
Mhm.
And the medicine works. How does it work? How does an antibiotic work? The antibiotic goes and it kills the bacteria. It has some mechanism of action that we can talk
Mhm.
about. Um, in oral health, it turns out that a key part, yes, is killing the bacteria, yes, is making the tooth stronger, but also is having something with substantivity. Substantivity. That means staying there and remaining active. And that has been the trick of all of our medicines. Even if you go back to fluoride, the trick has been that fluoride incorporates into the teeth, makes the teeth stronger. Great. It makes the teeth more resistant to acid. So normal tooth, the pH is neutral at 7, it comes down, so more acid. It's 5.5, it starts to dissolve. You put fluoride in there,
Mhm.
now it's like 3.5. So 100 times as much acid is needed to dissolve the tooth. Cool, that's great. But what happens when it dissolves? Fluoride gets released when it dissolves, gets released, and that actually helps to slow down the bacteria.
Mhm.
So part of it's making the tooth stronger, but a big part of it is that when the tooth starts to have a cavity, that fluoride gets reactivated. And that's a big part of it. Now, all of our other medicines work in a very similar way. Maybe they make the teeth stronger. Definitely they kill the bacteria. But when the problem starts again, they get reactivated and they help heal. They help stop the bacteria. They help clear out the acid. They help stop the sugar from being turned by the bacteria into the acid in one way or another.
So is it some sort of like a bandage that goes around the like infected area of the tooth, or is it like more oral?
Yeah, it's more oral. Um, so exactly. So for cavities, what happens is right where the bacteria sit, between your teeth or down by the gum line, right where the bacteria sit, that's where they cause the problem. So it's really that one spot. And then in the middle of your front teeth, they don't usually cause a problem, right?
Hmm.
So wherever they are, there's a little problem, there's a little lesion. The first thing that happens, and really the whole thing, is that it becomes porous. It loses its structure, but it's not just like a hole forms. We oversimplify it here by calling it a cavity, but you probably know the term caries, which
Yes,
is
there is.
just gives a more complex idea. So it becomes porous like a sponge. Well, it turns out that we can take a tiny bit of liquid, probably less than you would use for makeup, and that liquid, you just put it with a little microbrush right into the tooth and it soaks into the pores. So it's like getting a sponge wet. That medicine goes into the pores, and we have some medicines that actually fill in those pores and rebuild the tooth structure. We have some medicines that will embed and it'll have silver filling in at a microscopic level those pores.
Hmm.
Um, yeah, so those are usually so those are the main methods that our liquid medicines are used. They soak into the tooth to treat the lost tooth structure and the reason and what's causing it. We have similar things now for gum disease that we are liquids or gels that we put into the gum pocket
Hmm.
that break up the tartar and specifically suppress the bacteria that cause gum disease
Hmm.
so that you don't have that inflammation and it doesn't go into your bloodstream.
That's very interesting. But all like this like a medicine that you use for gum and for the teeth, does it get absorbed by the gut, or like does it can it affect the gut?
That's a great question. I was very concerned about that. So where I was practicing the last couple years is like the center of anti-vax, anti-fluoride country, right? And so parents were very concerned about this. And so we looked into it. And so there were a few studies that my friends did. I mean, they're university professors, department chairs. And so when I say my friends, I don't mean these
Hmm.
people on the street. I mean, people who run universities and things like that. Um, so if you take fluoride toothpaste and you brush your teeth with it, and you look at what happens in your bloodstream, you'll
Hmm.
see the fluoride go up and then go down. And you do that twice a day, fluoride up, fluoride up, fluoride up throughout the day. So what we were interested in is, does that same thing happen with these medicines, with fluoride in particular, but also silver, and also the peptides? Uh, and if so, how long does it stay up? And with the silver fluoride medicines, what we found is that you never see the fluoride go up. We have such a small amount of medicine. It's a very high concentration, but it's such a small amount of medicine specifically put into the tooth that the tooth just absorbs that in. And as long as you're reasonably careful and you remove the extra when you're done, 20 seconds, we don't see any fluoride go into the bloodstream. So presumably, basically none goes into the gut. And then silver does go into the bloodstream a little bit, and then tapers off over about a day and a half. Now, having a little bit of silver in your bloodstream is something that a lot of people in the wellness movement think is a good thing, based on the colloidal silver and all that. Now, I'm not going to say it's good or bad, but having a little bit for twice a year is really not going to cause any problems.